Heart attacks are more common than many people think. In fact, over 800,000 people in the US suffer from a heart attack every year. While these numbers are staggering, what's more important is how we respond when a heart attack strikes. The way you act in the first few moments could be the difference between life and death. In this video, we're breaking down exactly what you need to do in a heart attack emergency. Knowing these steps could save your life or someone else's. So let's get right into it. First, let's talk about what a heart attack actually feels like. A lot of people think that a heart attack always looks like someone suddenly grabbing their chest and collapsing. While that can happen, the truth is, heart attacks often start much more subtly, and that's where the danger lies. Many people ignore the early signs, thinking it's something minor or unrelated to their heart. The most well-known sign of a heart attack is chest pain, but the nature of that pain can vary from person to person. Some describe it as an intense, crushing sensation, almost like an elephant sitting on their chest. Others feel more of a tightness or pressure, as if their chest is being squeezed. This discomfort can last for a few minutes or come and go, which is why some people don't take it seriously at first. But here's something many people don't realize. The pain doesn't always stay in the chest. Heart attack pain can radiate to other parts of the body. For some, the pain spreads to their arms, particularly the left arm, but it can also extend to the jaw, neck, or back. This is where it can get confusing. Imagine having a dull ache in your back or a tightness in your jaw. Most people wouldn't automatically think they're having a heart attack. And that's why recognizing these more subtle signs is so critical. Another important symptom is shortness of breath. Even if you don't feel any chest pain, difficulty breathing could be an early warning sign. Some people describe it as feeling like they've just run a marathon, even if they've been sitting still. This sensation can be a key indicator that something is wrong with the heart and should not be ignored. Other symptoms can include cold sweats, nausea, or lightheadedness. These can sometimes be mistaken for the flu, indigestion, or even stress, but when these signs appear suddenly and without a clear reason, they could signal an oncoming heart attack. It's always better to be cautious and seek help if you're experiencing multiple symptoms at once. Now that we know how to recognize a heart attack, what should you do if you or someone else is experiencing these symptoms? The very first thing to remember is not to wait. Don't hesitate or waste time wondering if it's really a heart attack or just indigestion. The sooner you act, the better the chances for survival. The absolute first step is to call emergency services. In the US, that means dialing 911, but wherever you are, make sure you know the number to call. When you call, be clear and direct about the symptoms. Emergency operators are trained to assess the situation and can help guide you through what to do while you wait for medical help to arrive. It's also important to note that you shouldn't try to drive yourself or the person to the hospital. While it might seem like a quicker option, ambulances are equipped with life-saving tools that can begin treatment right away. An emergency vehicle will also take the most efficient route to the hospital, and the paramedics can provide care en route, which could make a huge difference in the outcome. If you have access to aspirin, take it or give it to the person having the heart attack. Aspirin works by thinning the blood, which can help slow the progression of the heart attack. Ideally, you should chew the aspirin rather than swallow it whole, because chewing allows it to enter the bloodstream faster. A single 325 milligram tablet is enough, but make sure the person isn't allergic or has been advised against taking aspirin by a healthcare provider. Once you've taken these steps, try to keep the person calm and comfortable. Heart attacks are extremely stressful, and the natural response is to panic, but it's important to stay as relaxed as possible. If you're the one having the heart attack, stop whatever you're doing and find a place to sit down. If you're helping someone else, encourage them to sit in a comfortable position, ideally with their back supported and knees bent to reduce the strain on their heart. In some cases, a heart attack can lead to cardiac arrest, where the heart stops beating altogether. If that happens, the person will lose consciousness and stop breathing. This is when CPR becomes critical. CPR, or cardiopulmonary resuscitation, is designed to keep the blood flowing to the brain and other vital organs until professional medical help can take over. If you've been trained in CPR, start chest compressions immediately. Even if you're not sure about the technique, it's better to do something than nothing. Place your hands in the center of the person's chest and push hard and fast. Aim for a rate of about 100 to 120 compressions per minute. If you're not sure what that feels like, think of the beat to the song Day in Alive. That's the rhythm you're aiming for. If you're in a public place, there might be an AED or automated external defibrillator nearby. AEDs are incredibly easy to use and provide step-by-step voice instructions. They can analyze the heart's rhythm and determine whether a shock is needed to restart the heart. Don't be afraid to use an AED, even if you've never been trained. These devices are designed for use by anyone and can significantly increase the chances of survival in cases of cardiac arrest. When it comes to heart attacks, time is of the essence. The longer the heart goes without oxygen, the more damage it sustains, and that damage can be permanent. Every minute counts. That's why acting quickly and confidently is so important. Let's revisit the story of Sarah. Sarah was at a family gathering when her father started experiencing some subtle symptoms, discomfort in his jaw and a feeling of fatigue. Most people might have shrugged it off as tiredness or stress, but Sarah knew better. She recognized these signs as possible indicators of a heart attack. Without wasting time, she called 911, gave her father an aspirin, and kept him calm while they waited for the paramedic. Thanks to her quick thinking, the paramedics arrived in time to provide immediate treatment, and her father survived the heart attack with minimal damage. This story is a powerful reminder that heart attacks don't always present with dramatic symptoms. Sometimes it's the small things, a bit of pain in the jaw or shortness of breath, that are the real warning signs, and acting on those signs immediately can make all the difference. The best way to be prepared for a heart attack is to know the signs and the steps to take in advance. You don't have to be a medical professional to save a life. Knowing how to recognize the symptoms, when to call for help, and how to perform CPR can put you in a position to make a critical difference in someone's life. Let's quickly go over the key steps once again. If you or someone around you is experiencing symptoms of a heart attack, call emergency services right away. Don't wait. Chew a 325 ml aspirin if it's available to help slow the heart attack's progress. Keep the person calm and comfortable while you wait for help. And if the person becomes unresponsive, start CPR and use an AED if available. These steps might seem simple, but they can save lives. And the more people who know how to respond to a heart attack, the better equipped we are as a community to prevent unnecessary death. Heart attacks are one of the leading causes of death worldwide, but they don't have to be. By spreading awareness and educating ourselves on how to act in an emergency, we can save lives. Now that you have this knowledge, it's important to share it with others. Have you ever experienced a heart attack emergency or witnessed one? Share your experience in the comments below. It could help someone else be prepared. And don't forget to subscribe to this channel for more tips on heart health and emergency preparedness. Together, we can all be better prepared to face emergencies and potentially save lives. Thank you for watching, and remember, every second counts when it comes to heart attacks. Stay informed, act fast, and always be prepared.